Hello, everyone. Welcome to the first 2023 MGFA Wellness Series webinar. Today, we are going to hear from Dr. Nagar from Northwestern University. He's going to speak to us about healthy nutrition and myasthenics. Dr. Nagar is a neuromuscular physician at Northwestern Medicine, Lake Forest, and a health system clinician at Northwestern University Feinberg School of Medicine. She is a fellowship trained neuromuscular physician from Washington University in St. Louis and residency from Loyola University Maywood, Chicago, with a focus on clinical neuromuscular disorders. Her special interest and focus is on myasthenia gravis, treatment goals, patient education, and empowerment. Compassion and empathetic patient care have always been the most important to her in the practice of medicine, along with cutting-edge treatment algorithms based in science. We want to thank our sponsors today, our national presenting sponsors, Alexion, Argenx, and UCB, and also our national sponsors, Horizon and Janssen Neuroscience. I'm going to stop sharing and allow Dr. Nagar to go ahead and share her screen.
Thank you.
Okay, I'm good. So I'm going to go on mute and you can go ahead with your presentation. And we'll do question and answer at the end. You can put your questions into the Q&A and we will try to get to all your questions at the end of the presentation.
Good afternoon, everyone. Can you hear me? So
Yes, you can. Thank you.
It's my pleasure to actually talk about a favorite topic of mine, myasthenia gravis and nutrition. At the onset, I'd like to thank MGFA and Ms. Dover-Levin for actually helping me sort of, get my feet wet into this topic and sort of advance my interest in patient advocacy towards care. So my thoughts and my presentation about the nutrition, which is a very important aspect of MG and MG care, comes to you from different angles. And at the end, we could sit down and sort of, look over some of the questions that might come through. So why is nutrition and myasthenia gravis of particular importance? Proper nutrition is very important on a daily basis for all of us. It's the vital component for health and well-being for all of us, especially in the setting of myasthenia gravis, where it tends to involve a lot of the musculature. It becomes even more important for us to think about this and take time. When proper intake may be difficult for these individuals because, chewing, swallowing, dietary restrictions, and certain medications make it all the more important for us to really think through all of these strategies. Thinking of a balanced diet, 3 meals a day, is sort of the first and a simple requirement for balancing out our diet. There are certain problems that are very unique to the individual who's affected by this neuromuscular junctional disorder that affects the muscles. The common challenges, which the rest of us take it for granted, which include chewing, which is so automatic, swallowing, which is so automatic to us, pose challenges for our category of patients. Just looking at the mechanics of eating sort of tells us why these are challenges. Just as we see on the screen, you can see from the pointer where the bulk, the tongue, the oropharynx, the actual active chewing, which involves our teeth, the muscles that connect the upper jaw and the lower jaw, propelling the food towards the back, the opening of the epiglottis to kind of, ensure that the food, closes, the epiglottis closing so that the food enters into the esophagus and not the other way around. It's a very complex machine that our body is anatomically modeled after. I think for this purpose, we can sort of see where we place as myasthenics, because we could all have unique areas of weakness that affect us in unique ways. For some, it could just be the eyelids. For some, it could be the muscles of the oropharynx or the muscles of swallowing or the neck muscles. So all of this sort of leads up to the fundamentals of how do we chew? How do we swallow? It's a complex orchestra out there. What is chewing? Chewing is a repeated action of the jaw moving up and down. When solid food is in your mouth, there are several muscles that go into this orchestra. The muscles of the lower jaw and the tongue move the food inside the mouth. It allows the teeth to break up the food into smaller parts to make it easier for us to swallow. Once the food is chewed to a consistency, the muscles of swallowing start to pick up this orchestra. They're from the face, the cheeks, bring the teeth to a closed position, and the tongue actually has to press towards the roof of the mouth to push the food back into the throat, into the passage, into the esophagus, and into the stomach. Then we have this tiny structure that's called the epiglottis, which we saw on the previous slide. It's almost the gatekeeper. It says, here, I'm going to shut so that the food can go right into the esophagus and avoid going into the places or the tubes that it does not belong into, which is the windpipe or the trachea. When the action of swallowing occurs, the epiglottis is our gatekeeper. It prevents solids, liquids from entering the lungs. Now, if the epiglottis itself sort of starts to have problems and cannot completely cover the windpipe because the muscles that support this action are weaker or they're episodically weaker, then this whole action with the liquids and the solids that enter into the trachea end up causing us coughing, which again, I think a lot of us can relate to on an everyday basis and see why this is important. So we can all take a look at the slide and say, hey, chewing is a basic component of almost every living being that's out there that puts food into the mouth and is fed. It looks so simple, but it is a very complex issue. Now, the how challenge for myasthenics, it's a big question. Let's sort of break it up into different components and see why. Each meal for us, it should also be the food that we enjoy, but also should have the essential nutrients that come from the 4 basic food groups. The bread and the cereals, the primary carbohydrates that are the sugar producers, the sources of energy, or the batteries that fuel us. The second group, the fruits and vegetables, which are also sources of energy that provide the body with vital vitamins and minerals that help us function. Now, coming on to the food, that's the protein category, which is necessary for healthy tissue, healing, fish, poultry, meat, eggs, all of these fall into that category. And then, of course, we have milk and dairy, which is rich in calcium, in vitamins, minerals that are essential for us to maintain our normal bone structure. So this kind of slide sort of gives you, when you think about dividing up foods on your plates, the basic food groups that we have, the fruits, vegetables, grains, protein, dairy, anything that's into this category that can pile up are easy reminders that we really need to kind of have a good diet to enable good nutrition. Have plenty of fruits and vegetables, a good amount of protein, drink lots of water, choose whole grain foods, important. But when you're a myasthenic, you could say all of this and sort of say, hey, you know, how can I do this right? Because the gatekeeper to send the food down the right highway, the esophageal highway, as we said, and the little structure called the epiglottis that says you're not going to go down the wrong way. All of it depends on the muscles. And as a myasthenic, our muscles sometimes become sources of like, you know, I'm not going to coordinate with this orchestra of eating well. So that's a barrier. Several things that actually sort of become challenging in a myasthenic is that repetitive action of chewing. It has a weakening effect on the jaw muscles. Weaker neck muscles make it difficult for us to push the food back into the throat and down into the stomach. So primarily, there are a number of difficulties that are unique to myasthenics. And what should we take as seriously when we're trying to correct this? Remember some simple techniques. Always sit upright while you're eating or drinking. This helps reduce the chance of choking. If coughing occurs, the act of leaning forward is actually a good way to minimize that. Close your mouth, take small amounts of air through your nose, and sometimes a strong, forceful cough will help push the irritating substance out of the throat. And with all of this, it's interesting how literature and common sense tells us to remain calm, but it's highly anxiety provoking when we know that our muscles are not the strongest. So a word about like, how do we plan? Plan for meals when your muscle strength is at its best. You're stronger an hour after you take your medication. It may be wise to eat the main meal in the morning when the muscles are the strongest. Rest about half hour before meals. It gives your muscles that adequate rest to complete its task that's coming up. Following these suggestions make it a little bit more easier to chew and a little bit more easier for us to swallow and much more easier to sort of get through the difficulties that so many of us take so much for granted, which is not so with MG. Eating small portions and resting frequently between bites, it prevents jaw muscle fatigue. It's an important pointer. Remember that the texture and consistency of the food can either be helpful to you or interfere with chewing and swallowing. Like textures that are much more chewier, harder to chew, steaks, etc., sort of need us to plan how we're going to do this and perhaps benefit from resting before that sort of a meal, helping the swallowing process get a little easier. Softer food consistency is less strenuous on the jaw muscles. Drinking small amounts of liquids with solid food also soften the food consistency and make it somewhat easier for us to engage in these activities. Certain other tips: have a dental exam regularly. Follow a program with good dental hygiene, with brushing, flossing after meals and snacks. Good dental hygiene assures better chewing because you're avoiding things that are dental in origin. Unhealthy teeth and gums often create more problems, especially because if we have weaker jaw muscles, we really need to have a powerful set of chompers and gums that are healthiest to be able to embark on this everyday task. There are some unique needs when talking about a myasthenic and nutrition. MG medications have side effects that may necessarily need you to modify your diet as dietary modification, chewing restrictions, potential side effect of medications that all of you listening today might have had the exposure to. One of the most potential side effects is diarrhea, which is caused by our primary anticholine esterase medication, Myasthenic, is well known to 100% of us. it is a very disabling and disconcerting sort of and self-limiting side effect that occurs with Myasthenics. Generally, it tends to sort of settle down over time. My tips on this, if you have occasional diarrhea, make sure you're well hydrated, drink extra liquids to replace the fluid that's lost, in addition to the daily requirements of your 8 glasses of liquid per day. Liquid diet consisting of broth, jello, clear juices can replace one of the daily meals to allow for the bowel to rest. You could try that as well. The next meal that follows the liquid meal should be solid food, but I think it helps us not regurge or develop GERD if it's much more on the bland side. Bland foods, what examples would we like to take from there? Plain baked broiled meats, soft cooked eggs, rice, cooked fresh vegetables, cooked fruit. They're low in fiber content and also allow the bowel to rest without repeatedly sort of stimulating the bowels to urge on with the diarrhea. At that time, if you think that diarrhea from Myasthenics is an issue, think about reducing like salads, spicy foods, heavily spicy foods, spiced casseroles, and some of the fresh fruits that can often aggravate the diarrhea. However, I always say check with your doctor before taking antidiarrheal meds over the counter. If diarrhea becomes a persistent problem, then do check with your primary physician as well as your neuromuscular physician or your neurologist. Now, one of the things that we want to pay a lot of attention to is an MG patient. Patients do take steroids as a part of their treatment regimen. Fluid retention becomes another side effect that's seen in an MG patient. High doses of steroids such as prednisone or ACTH actually cause the body to retain the water. Steroids cause body to retain salt or sodium, which then holds on to the water. To help decrease water retention, we generally say when you're on prednisone, do eat less salt. Don't add extra salt or foods when cooking, or you're at the table and you want to use the salt shaker, sort of stay away from it if you're on prednisone. Pay attention to labels, pay attention to certain commercially prepped foods. Not all of us are privileged enough to cook a fresh cooked meal every day, but reading the label, trying to look for things that could aggravate this is really important. Commercially prepped soups, sometimes smoked and cured meats and deli meats do often have sodium in them, which can add to the fluid retention. Label, right? Like we talk about food labels, it's really important from what's listed on the labeling of your package. How much is the sodium? What is its content? And look at it and see if you can avoid it. When you're on steroids, again, potato chips, pretzels, these are all very high salt content foods. They're better sort of avoided. You know, go out after your fresh vegetables instead of the can because they contain less sodium. Again, fresh cooked veggies also provide more minerals and vitamins, but do not have the salt that has to be used when things are canned. Frozen vegetables can be used. Make sure it's not glazed. Glazed frozen vegetables often have sauces in them and also have salt. Now, a little bit about the commonly used, prednisone. Weight gain is a side effect of prednisone. Prednisone just redistributes the fat into the face, the back of the neck, the abdomen, and these changes could be variable from one person to the next. Generally speaking, the higher the dose, the longer duration of treatment, the greater changes we see with the redistribution of the fat. Weight gain when taking prednisone is typically because we hold on to the water and the increased caloric intake because of the increase in appetite. In addition, those with predominant sort of other comorbid conditions such as lung disease, or lung involvement or shortness of breath with MG or neuromuscular weakness that is at the shortness of breath level, diaphragmatic level, often have more difficulty maintaining some of the physical activities that is really important in moving the fluid around. So prednisone and, appetite and MG, typically we know that it increases your appetite. It increases your caloric intake, but the increased appetite could be difficult to control. And this is out of your sort of, realm of being able to control. But how do we take charge when we have to live through what we actually have? And how do we make it easier for ourselves? Was the basis of why I wanted to actually spend a few minutes talking about this. Some of the increased appetite issues can be difficult to control, but there are some basic tips where hey, this is what maybe I can do to control the amount of calories and the quality of nutrients you eat. Eat small, eat frequent meals with good nutritional values. By that I mean, if you enjoy, having fried food or French fries with your main protein meal, make that into a smaller sort of, component. So you actually get a high value food with high nutritive value. That is your protein, your vegetables, along with something that you actually enjoy, but do so with a smaller meal. Eat a high protein, low carb diet. Well, carbs are also equally important, but low carb, high protein diet is effective for losing weight in a traditional low calorie diet that's low in fat and portion controlled. And as we go on into many, many different comorbid conditions, whether it's, the most frequent one with diabetes, the most frequent ones with GERD, whatever that comorbid condition might be, a high protein diet generally tends to control or suppress your appetite for longer periods of time because it fills you. And it's complex for the body to break it down. And it has high nutritive value and is helped in healing and tissue repair and building body. So again, sort of, some of the tips: eat carbs in the form of fresh fruits, vegetables. Again, remember, prednisone by itself has a tendency to raise the glucose or the sugar in your blood, which causes, again, this balance between increased body fat, propensity to diabetes. So avoiding some simple carbs, concentrated sweets, that of course are my favorites and everybody else's too at some level: the cakes, the pies, the cookies, the jams. And of course, it's all the foods that taste good: honey, chips, bread, candy. Some of these will, avoiding some of this tends to actually keep your blood glucose or blood sugar low. On the fats, limit the saturated fat and cholesterol. Pick from lean meats, pick from your fish, pick from the choices in poultry. Avoid them from being fried, and foods with extra oil, butter, margarine, mayo, and again, the fats that we tend to look at as comfort food and reach out for, but limit the saturated fat and the cholesterol. Pay special attention to foods that have calcium. Remember, prednisone, again, alters your body's ability to use up its calcium. And that's why, having about 4 servings or more of calcium-rich food per day is really important in preventing osteoporosis. Check with your physician, check with your primary care, your NPs, your primary providers, whether you may benefit from calcium supplements while you're on this road of treatment. So what are some of the other effects of our steroid medication? We have to remember that it can lower the level of potassium, fluctuating appetite, and weight gain. So again, Remember, lower levels of potassium translates into a feeling of weakness, muscle weakness, lethargy as well. So if those things do occur, I could not stress upon the importance of actually having routine blood work check, whether it's your CBC and CMP, which look at your sodium levels and your potassium levels, glucose levels, to actually keep good ideas of where you ballpark are and what might we be doing differently to be able to sort of help our bodies, conquer MG. I generally say a fad diet is not a good thing in any circumstance, and particularly for our MG patients. I think I'm more so against fad diets because they simply don't work. It's difficult to sort of, control weight gain and appetites from steroid use. You got to be nutritionally balanced, and you should really exercise a lot of caution with these fad diets where you do not want to have your medication-induced effects be sort of negated by acquiring certain dietary challenges that could actually put you on a highway to not feeling so well. When you think about, hey, I want to embark on a weight deduction plan, I want to reduce my weight, do talk to a nutritionist, do talk to your, dietary dietitian. Sometimes if your blood glucose actually tends to run higher, talk to your diabetic educator. As a myasthenic, what can I do to actually be better about my nutritional needs, because it is very unique. And again, any supplements like vitamins and minerals. For example, all of us here, I bet we know that magnesium, which is sort of, something that's very commonly being used now as a muscle relaxant, magnesium calm, helps me sleep, again, is for a myasthenic, not something that is taken so loosely to say, I'm going to take a magnesium supplement to help me relax my muscles. So things of that nature, please do consult your physician about nutritional supplements, and such as, vitamins and minerals as we example. I also say this, there's no reason for a person with MG to avoid travel or social affairs. I think, like with everything else in life, we just need to plan ahead. We can't eat out. We need to just plan ahead. Many restaurants, hotels, airlines are cooperative about like special food needs as long as advance notice is given. I also say that I really think that, patient advocacy for myasthenia has grown. People now know what myasthenia is. I think at many levels, many people either have a family member or a friend. The recognition, thanks to MGFA, has really sort of taken off over the last, several years that I myself see and hear from other areas. So making a special request, not a bad idea. We're just putting it out there that my needs may be unique to me. So, giving people an advance notice is well respected. Now let's kind of have a word about alcohol. We all enjoy alcoholic beverages in moderation. 1 or 2 drinks are acceptable for people with MG. Others may not be able to tolerate any alcohol if their weakness is severe. So do remember that. Check with your doctor to see if drinking alcohol is advisable by practicing measures of planning ahead, making sure the basic principles of good nutrition, the person with MG can have a very, fulfilling and a healthy life. And it just becomes an adjunct to our well-being as someone that has a neuromuscular junctional disorder, or myasthenia gravis in particular. And with that, I think I've covered kind of simplistically. And I really thank all of you for being on this highway today. It's a rocky road sometimes, but it's actually a peaceful, well-planned road if we can plan ahead. Thank you.
Thank you so much. We have quite a few questions. If you are willing, I'm going to read them to you as we go down the list. And you can comment on them. I think some of them sort of go over the same thing, but I'll look at them and read them to you. The first question says, I've heard that looking down makes it easier to swallow some items such as pills. Do you have a recommendation?
Actually, looking down is sort of bending the neck forwards. And like I had said at one of my earlier slides, that does help some folks with MG get that test done. Yes.
Great, thank you. The next question is, should gluten be avoided with myasthenia gravis?
You know, again, remember that gluten-free foods, although are catching up, are also sort of sometimes replaced by fat, right, to make it gluten-free. So again, you have to weigh your personal sort of comorbidities, meaning whether you're looking at hyperlipidemia or high cholesterol, or you're looking at, you know, blood glucose issues, your other medications before you embark on that diet. But it's a good thought, but make sure you consult your doctor if it is appropriate from your other medical conditions if you have any.
Perfect, thank you. Do you know of any foods to avoid that can worsen myasthenia gravis symptoms?
One of the common things that we talked about at the very end was supplements that essentially like magnesium. But I think, like we always sort of say, incorporate all the food groups in moderate amounts, prepare ahead of time, and then be able to eat and enjoy all the food groups that you like.
Perfect. The next question is, my doctor says eat prior to taking Mestinon to lessen the GI side effects, but swallowing before taking Mestinon is a huge challenge. Any suggestions?
Joel, could you please repeat the first part of the question?
So this person's doctor says if you eat prior to taking your Mestinon, you'll lessen the GI side effects of the medication, but the patient finds it hard to swallow before taking Mestinon.
And that's a common scenario that we see in clinic. We often say rest before your meal. Perhaps take your Mestinon 30 to 40 minutes before you plan to eat that meal. Often helps overcome that weakness. I do understand where they're coming from as a physician, saying that, you know, eat before to minimize the diarrhea or these GI side effects that we might encounter. But taking the Mestinon a few minutes, 30 to 45 minutes before any particular form of exercise, and that being swallowing and exercise at this point, right, is still worth considering and seeing how you can mitigate the GI side effects from some of the components we discussed earlier as to mitigate that.
Okay, thank you. The next question is, a lot of MG patients take shortcuts to cut down on the energy it takes to prepare healthy foods. For example, there are vegetables in a bag that simply require throwing in the microwave and steaming them. The vegetables that are prepared this way, do they maintain their nutritional value?
You know, that's such a good question, and they do. If it's your cut, steamed, bagged vegetables, which are often not glazed, and you don't add any specific sort of, you know, sodium-rich sauces on top of it, if you're not on prednisone, steaming vegetables is a very healthy way of actually, you know, cooking your vegetables, and you don't have to stand in front of the, you know, gas top or the cooktop for cooking this meal, which again, conserving energy for our myasthenics is really an important way of, you know, holding on to the energy that we have for maintaining our muscle functions. So microwaving your meal, as long as you're doing it like in a steamed manner, not a prepackaged prepared food is what I should say, I think is a good thing.
Perfect. So we have someone who's a vegan and they're asking what they can replace meat, fish, dairy for as a vegan. What can they replace those things as a good source of protein?
You know, a lot of vegan and vegetarian sort of protein substitutes, which include edamame and soy-based proteins, are also sort of important ways of catching up on the protein meal. So that's one. And actually, if you're able to have some semi sort of solid, throwing protein granules into your smoothie is a good idea with your vegetables, and sort of supplementing protein that way.
It's funny, the next question actually asks about peanut butter. Is peanut butter a good source of protein? But I imagine that would be fairly hard to swallow.
Totally. But then adding a couple of scoops of peanut butter in the same sort of smoothie, or something that you would like to eat, or even, into your meal. With some people do cook with peanut butter, right? Peanut butter is used in some of the sauces too. So that gives you that healthy mix of protein, but then mixing it in with drinks that you would enjoy, whether they're smoothies or, Slurpees, whatever they might be, actually gives it that consistency as well as the protein for it to go down a little bit smoother.
Great. Do you know if there's any research evidence supporting or refuting intermittent fasting in MG?
Particular to MG, there isn't, and I was sort of trying to kind of dig into that I have come across. But I'm sure as the medication-induced stress issues of prednisone, as well as the comorbid conditions we all acquire through our lives change, I'm sure there's going to be evidence of intermittent fasting, but not that I could find. But then again, be very mindful of going for extended periods of time without sort of having a small meal, because you could potentiate your weakness.
The next question is asking, how much protein do you recommend in a day?
Again, it's so different for the conditions that you might have, that you might need to be mindful of. It's anywhere from, a gram per kilogram. Sometimes we could go up to that amount of protein, but you got to make sure that there are no other comorbidities that filter the protein through the kidney.
Thank you. We have a few more questions. Someone is asking if you have any nutritional tips to help with leg cramps. I drink a lot of water already, but take Myasthenics.
So, cramps, again, with the lack of or challenges that we deal with medications that we take, with alterations in the electrolyte balances, make sure that you looked at them, have your blood work in order. If you're taking prednisone, that your potassium and your sodium and all of those levels are checked. And despite of that, if you have cramps, sometimes adding, a little bit of an electrolyte into the water that you actually might drink, such as your sports drink or Gatorade. And I always say, because there's sugar content in all of them, be mindful, maybe 1/3 cup of it into the water, to see if at night that might be a useful way of controlling the cramps.
Great, that's a good tip. The next question is, with taking drugs like Celcept or azathioprine, due to the immune suppression, I was advised not to eat sushi or raw milk cheeses, raw egg dressings, etc., and get meats cooked medium or well done, not rare. Can you comment?
It's interesting, right? When we suppress our immune system, or we try to modulate our immune system to be able to sort of help, the basic underlying disorder that we have, we got to be mindful of acquiring any of these infections that we may not have an idea about, whether it's parasitic in nature with the, sushi, and whether it is raw eggs and salmonella that we would become susceptible for. It's very mindful to pay attention to these things. And I agree with those recommendations. And then eating things that are rare versus well done is an important strategy to minimize the risks when we're immunomodulated.
The next question is asking about focusing on decreasing inflammation and improving their gut health. Are there any probiotics? Do you recommend probiotics? And if so, what type?
Generally, lately, I've had patients ask about probiotics, and I always also say, because here, I think at where I work, I also have the ability to discuss the same with our diabetic educators, with our nutritionists, to sort of say what might be a good sort of a probiotic approach. Now, things such as things that have a good lactobacillus culture, certain cultures within yogurt and stuff are really good on the gut anyway. Incorporating some of that, into your everyday routine is a good way of getting some of these probiotics rather than to take a supplement. And now if you look at it, every drink is fortified as it's a probiotic, kombucha is a probiotic, right? But whatever you do so in moderation and try to acquire the probiotics from natural sources.
Great. So we have one last question, and then we will wrap this up. So if someone's really having a hard time eating it on a certain day, someone's asking, are protein drinks such as Ensure okay as a substitute when swallowing solid food is difficult?
Again, because it's balanced, it's Ensure, Boost, and other things that are out there that actually say you have a certain amount of protein in there, there's a certain amount of, balanced amount of sugar in there, and low sugar content foods are really sort of a good way of acquiring protein-based nutrition. And also things, if you're able to have that consistency in your Ensure, adding a couple scoops of peanut butter only fortifies that, makes it easier for you to get the good fat as well as the protein, along with the protein that's there in your Ensure. So those kind of things, I think, would make it novel and somewhat easier for you to acquire proper nutrition.
Great, thank you. Well, thank you so much, Dr. Nagar. This was a great talk, and I know people will have many, many, many questions about this. We could probably go on for 2 more hours, but we really appreciate your time. And this webinar will be posted on our website, so people can watch it if they missed it. And thank you everyone for joining us today. And thank you again for your time, Dr. Nagar.
Thank you, Ms. Levin. It was wonderful. It was really nice to interact with a good group of people. Those were excellent questions. And feel free, if there's anything that's posted and you want to ask a question later that I need to answer, I'll be happy to.
Great. Thank you, everyone. Have a great day. Thanks a lot.
Thank you.
Bye-bye.